all in favor with aye?
Aye.
Opposed? I have it. That's it from you, clerk? That's all you have? Good. I had number 6 item. I'll tell you why I added board. I just wanted to add it so I can talk about it. I want us to have a workshop date that we can set pretty quick. We just approved our budget. And we know there are going to be some changes in HAT, Private Social Service, and also the Health Department, and probably some other departments. Before we get into this budget too deep this fiscal year, we need to go in and grab it, research it, look at it again to make sure that we have dollars that our seniors can continue to get Meals on Wheels and can get hot meals at home and can go down to senior service and eat meal. Also make sure that the dollars that come from the federal government for school luncheon, we need to take a peep at that to make sure that in case something happens, we have the dollars available to make sure that every child that will be able to get a hot meal in school. Some don't get a good meal at home, but school is where some of them get the best meal. And our seniors that have to go to the doctor, hospital, Chapel Hill, and certain places, that is something that HATS does for us, but it takes money. That program is a service that we offer that, we always go in the hole with it, and we're going to go deeper if we don't take a look at it at this time. And for us, the grants and the different dollars, Medicaid and Medicare, it has been cut, will be cut, on the chopping block. And I just want to make sure that Hoke County, we get ahead of it. So when the cuts start coming, however they come, that we be ahead of it, that our citizen is first and number one here, that none of them have to suffer from these issues, especially the seniors and the children, and along with the rest of all of us are soon moving into the senior area. Some of us already in it, but those of us not, we're moving close. And I'm one of those that's already in it. So I like for us to go back and look at some things in that budget, look at the whole budget, and see what it is we can do different, see what it is we can do with some line items. As you know, that we have a line item budget, and all the dollars put into different line items from different departments. So I'd like to go back and research and see if there are any ways, anywhere, anyhow, that we can hold those dollars for those seniors or children or those who need Medicaid, Medicare, whatever the cut can be. This is the time to do it because you just started a new budget and all the money's still on hand. As you get deeper into it, the money won't be there to do it. So I want to make sure that Hoke County is taken care of and that our citizens have the best opportunity anywhere in the state. We're number one county in the state of North Carolina. We want to stay that. And you do that by getting ahead of the ball game. So we start right now working on it, fixing it. I think we can get ahead of it. I'd like to have a board, if you would. Let's take a workshop one day, quick as possible, and look at that.
Mr. Chairman.
Yes, sir.
I just want it to be clear to the public that, we just passed the budget a day or two before June, the deadline, June 30th. And we know that the big, beautiful bill, I know you didn't mention it, but I'll mention it for you. The big, beautiful bill passed the 1st of July, got through the Senate 51-50. Thank Tom Tillis for having good sense of trying to help save Medicaid. But the result of us having to go back now is because I was reading through the bill today, actually, because I run a program, a light heat program that DSS runs also here for the county. We run it for 4 counties for Native Americans. All $4.2 billion for the whole United States was cut out of that light heat program. In other words, in the wintertime, it helps a lot of seniors with what they refer to it as the fuel checks. That's what they call them, the fuel checks. And what happens with that program is that folks will come in, and if they qualify, and it's income-based, they qualify income-based, then what you do is you give them a certain amount of money to the vendor, if it's Rayford Oil Company or the light company. If they heat by electricity, right, you send it to the light company. You don't send it to the person. A very good program. And the whole thing was cut out of the budget, all 4 points. So that means this coming up fall or winter, when folks are coming to DSS looking for money to help seniors, they're not going to be a dime there for them unless somebody during appropriation puts this money back in the budget. So let's just be clear, while we're having to turn around after passing a budget, that we've got to have a meeting now because of the big, beautiful bill that has been passed, and that is going to cause us to have to probably cut some other programs so that we can help with some of these programs that are going to be in dire need probably by the time this budget goes into full effect October 1. So I just want to I want to put that out there so everybody understands we didn't miscalculate. We didn't mess up our numbers. We know how to figure revenue versus expenses. Well, some of us been doing it quite some time now. This lady's been doing it for a long time, and our finance people, we knew exactly what we were doing. But then here, when the big beautiful bill was passed and made all the social cuts, the social programs that help elderly people and children is what mostly got cut out of this budget. They referred to one of the reasons that they took it out of their budget was a audit that was done in 2010. 15 years ago, that found 11,000 people that got light heat persistence. And somebody may say, that's a lot of people got light heat persistence that shouldn't have gotten it. But that's 11,000 people in the whole, out of 7 states. In my department alone, I served 3,500 people last year. 3,500 people. So a small program just like mine served 3,500. 11,000 people probably weren't 1% of the total. See, they didn't list the total number of people that were served. They just list the few that got through the cracks. And there's not a program out here that we run that somebody don't get through the cracks. Somebody slips through. But when you have a one-sided administration that tries to find problems, and then you know what's happening? It's coming to the state, and you know what the state's going to do with it? They're going to send it right to the county. That's where they're going to send it at. Public education, millions and millions and millions of dollars, just like you said, for free lunches for poor children is going to be passed to the state. You think the state's going to take it up? No, they're going to pass it right down here to this county. And unless we take it up, there'll be children that's got to pay $1.50 for lunch that don't have $1.50. You know, and it's pitiful. It's really despicable is what it is. And I'm going to call it what it is, Mr. Chairman. And I'll gladly take a day off from work to spend another day trying to figure out how to help our people here in rural Hoke County and to make sure that our citizens get served, our children get fed, and our elderly are able to go to the doctor and do what they need to do. Mr. Chairman, you pick a date, I'll take a day off.
Thank you. Yes, sir.
I just want to echo Commissioner Hunt. I mean, he's right on point.
Yeah, not tomorrow.
Just looking at the bill that passed, $644 billion is going to be a tax break for the billionaires. $420 billion is going to be a tax break for corporations. But they're going to take $700 billion and cut Medicaid. They're going to take $200 billion and cut SNAP, nutrition programs. And it keeps going on and on with education. So the rich is getting richer and the poor is definitely getting poor. But on top of this, what you're not going to see is when you cut $720 billion in Medicaid, that's the equivalent of about 14 million people across the country. So hypothetically speaking, for example, if you're on dialysis, if your Medicaid is cut, you're not going to get dialysis unless these agencies wants to try to assist, which they can't really and not pay their people. So this is a immoral bill, in my opinion, and it trickles down. It started at the top, but it's going to trickle all the way down to the local level. So we're going to have to, Mr. Chairman, meet, and I want to applaud you on your vision to say, let's come together now and get this worked out, because we're going to have to make some changes to take care of our people. That's our job. That was the oath that we took when we all took this office, that we're going to do what's right about the people of Hoke County. We're gonna continue to pray, that things get better. But at the same time, God requires us to do some due diligence and making sure that we do the right thing. So I applaud you, Mr. Chairman, on that. I definitely stand with Commissioner Hunt on this, and I hope the whole board sees fit that we need to come together as soon as possible to make something happen for the Hoke County citizens.
Because when you cut Medicaid, it automatically cut Medicare. Automatic. When you take that type money from Medicaid, it's going to hurt Medicare. Medicare is to the worst of those who not able to do anything. Medicaid, you can work, do a little something. Medicare is to those who's just not able to do anything. It's the worst of the worst when you take from Medicare. I don't know the reaction yet that it's going to have on social service. We know we're going to probably lose some people. And I don't know the reaction it's going to have on the health department, those grant dollars and those different services and those different vaccines that we get. And none of us know now. None of us know the effect. But to be proactive, as they have said, we need to go ahead and now go back into our budget line items and have dollars to make sure that Hoke County is taken care of. You need to understand this. With one disease from your neighbor, and you don't have to get rid of it, it spread across the county. You might say, it's not me. I don't have to worry about it. I got the money to go to the doctor. Disease have no respect for money. None. So it'll spread all through our county, whatever it is. So you have to keep what you need within your county. So I'm saying, folks, if we can meet this Wednesday morning at 10 o'clock, 9 o'clock.
Mr. Chairman, I make that a motion.
Yes, sir.
I make a motion that we meet, or we set this meeting, Attorney Hunt, to Wednesday morning at 9 o'clock, to discuss, I would say, the budgetary issues.
Manager, please have your finance people present, have them with the budget in the hand, so we discuss what step we must take now to be able to hit this head on.
Yes.
So we'll recess it once.
Once we're done.
Yes, okay.
That's how we get it. That's why we are number one. We get ahead of things. You do it full time.
So we can do it, at the end of the
At the
meeting.
end of the
Recess
meeting.
at the meeting.
Yeah.
Okay.
We recess.
Sound good.
Michelle came up with the.
All right, Mr. Manager, it's your report time.